Hello, and welcome to another episode of the Med School Minutes podcast, where we discuss what it takes to attend and successfully complete a medical program. This show is brought to you by St. James School of Medicine. Here is your host, Kaushik Guha.
Hello, everyone, and welcome to another episode of Med School Minutes, where we talk about everything MD related with a focus on international students, specifically Caribbean students. Today, we have a very interesting guest. His name is Dr. Stavros, and after finishing his MD, he's chosen a path of entrepreneurship and dedicated his career to really helping students realize their dreams of making it and passing the exams. He has over almost 2 decades of experience managing and handling and helping students do better in step 1, step 2, and step 3. And he's essentially an expert on the exam. So we're here to talk to him about what the changes in the structure of the exams in both step 1 and step 2 are. And generally, his passion and his choice to not really practice medicine, but go into a field where he is still involved with medicine, but at the same time, helping students as much as they can. So without further ado, let's welcome Dr. Stavros. Thank you so much for joining us, Dr. Stavros. Why don't you give us a quick background? This is how we always start our podcasts. We always request our guests to give us a quick background about themselves.
Well, hi, everyone. I'm Dr. Stavros Vouyiouklis, born and raised in New York. I went to Manhattan College, undergrad in biochemistry, 4 years. And then I went to the Leavitt School of St. James for med school. I did realize as I was prepping for the board exams that I had a certain purpose, certain goal, certain calling. And then I worked on USMLE prep because I realized that no matter what I did, it was very challenging to pursue these exams and do very well, right? All of us have had issues in these. And unfortunately, your career, your future in medicine is dictated and basically set in stone because of these scores, right? So what I did was from being in medicine, I realized I had more of a passion to work with students and physicians to crack the code and help them pass the board exams. So 15 years later, I'm on my 5th company as far as adapting to how the USMLE adapts, right? So we adapt to better ways to prep our students. And now I'm here talking to you today to make sure that all our students out there internationally and in the States know as much as possible for step 1, step 2. So then it makes it easier for them. So they don't have to settle for less. They can then shoot for the stars and achieve their goals in whatever residency they want. So here I am today to provide my knowledge of 15 plus years so you guys can all profit and be better physicians for improving our healthcare. Right.
So essentially they're twofold. We're killing 2 birds with 1 stone, so to speak, by talking to you, Dr. Stavros. Well, one is we're talking about, so obviously you went through, got your MD and everything, but then you chose to be a serial entrepreneur, completely aside from running a regular practice, and you chose to go into this route. We definitely want to pick your brain a little bit about once you get an MD, what can you do with it other than practice medicine? Again, I mean, because for a lot of our students, it's like, my only alternative is to become a hospitalist. But that isn't true, obviously, as you're like a shining example of that. And you're not just the only one. We have several physicians who's gone on to start various consulting companies that actually consult with hospitals, entirely admin purposes, et cetera, et cetera. So we want to talk a little bit about that. And the other aspect is obviously with 15 plus years of experience with 5 companies, as you said, you have adapted to the changes in the USMLE. If there is anybody who I would consider to be an expert at the USMLE exam, it is definitely you, because you've been seeing the changes firsthand from the time you took it to the time when there were two CS or step 2 exams, then becoming 1, then eventually becoming a very involved exam and then the step one, pass fail, going away. So let's start with you, and like, what alternatives do you think, or what would you advise students? Because unfortunately, medicine is such an involved practice. Like, you pay so much of money, you invest so much of time. A lot of people just don't think that beyond becoming a hospitalist or beyond practicing, I don't have alternatives. What would your advice be to that student?
Well, I mean, it's a great question. I'm happy we're talking about it. I myself, I'll go back a second so then we can move forward with this question. I realized through my rotations and my studies, not only did I love prepping and teaching, but I realized that there was more for me than just being in the hospital. So I was honest to myself, and I was very lucky that I was really enjoying what I was doing and prepping students. But students now need to realize that you focus hard, you go to school, like you said, you invest, you get into residency, if you choose residency, and then what do you do after? A lot of times I've seen doctors not finish residency, they jump out of residency and they go, well, I can't even finish it. I don't know what to do now, because they were so into surgery, anesthesia. Yeah. So what I can say to our students now listening and watching now is, you got to be honest with yourself and say, okay, am I choosing internal medicine because I love it? Or maybe I'm in love with the idea. Or am I going to surgery because I love it, but do I really know what surgeons do? Right. And other times people are like, hey, I burn out, I'm done. I do not want to continue medicine. So if you have an MD, well, yeah, you can be a consultant. There's many different avenues out there to say, well, okay, I went to school, I finished my medical degree. Either you finish residency or not, are you licensed or not? So it all depends, right? If you're licensed, you can move on to consulting different companies, pharmaceutical companies, versus you finished MD, and then you say, well, you can then venture into certain specialties that can use your knowledge, right? 4 years in medical school is a lot, guys, right? Right. You do 2 years in classroom, you do 2 years of rotations. People can use that knowledge for their advantage and yours in majority of specialties out there in businesses.
Yeah. In this vein, I actually wanted to talk about this. This is one of our partner hospitals. The CFO reached out to me very recently. And they have a program where they train financial analysts. And they called me up, the CFO called me up, and he's like, I really want to have MDs come for this program. And I was like, wait, but they're MDs. Like, why would they go into finance? And he's like, well, I'll have you know that. Then the CFO was like, I'm an MD or MBBS from India. I came to the United States several years ago, and I didn't match the first attempt, and I needed money. So I started working here. Sure. And he's like, and billing and finance, it's not in a hospital. It seems like it's a very different function. So I'm a CPA, so I, know a lot about working in corporate America and being in consulting and stuff like that. But it seems like finance in a hospital serves a very different purpose. In most companies, finance is quote unquote a back office function, or it's a cost center. You're not necessarily generating revenues. But in a hospital, finance can actually generate revenues. And correct me if I'm wrong from your experience, Dr. Stavros, but he said that he feels the most successful financial professionals within a hospital system are MDs, because they understand, they know how to code certain ailments in a certain way that boost the performance of the hospital and make it look better in the eyes of, say, Medicare, Medicaid, different governments and stuff like that. And he's like, it's just easier to train because, if somebody comes in with a superficial ailment, but they have something underlying, a CPA who has no medical training is not really going to understand that. Sure. Whereas an MD does. And to me, that was very surprising. So this particular training program, it starts off with like a resident salary, but within about 2 years, you become a full-blown financial associate, and then you're kind of on a track for a CFO position. And this particular gentleman is a CFO for 50 different hospitals right now.
I mean, that's very impressive. And the reason, and it's nice that we're sharing this knowledge because, when one of my previous companies, we were employing physicians to be coaches and mentors. And most of the people, all 500 applicants, 520 actually, they were all American students who graduated, or either finishing residency or in the middle of, they just dropped out. And they're all American grads from top university programs. There's a reason why I say this, because they're burning out, right? So what did all those 520 people do? Reached out to me to get a pay cut from 450, 350, 250 to less than, roughly 80 to 100,000 for a coaching position. It's like, well, you're giving up all that opportunity, all that time invested in your life.
Yes.
Happy. You see, that's what people need to understand.
Right.
If it's one of you that, hey, I don't want to continue. Yeah, there's a lot of companies that, for example, short-term disability, long-term disability, insurance companies, instead of having someone who has no knowledge of medicine, they say, well, we'll hire nurses and or MDs to consult and be like the head of the department to say, well, if someone has a back issue, they had a herniated disc, do they 4 weeks or 12 weeks? Well, if you don't know the reason behind, like, are they standing versus sitting in their occupation? Are they overweight? Are they have other risk factors? Maybe they need 10 weeks. So you see MDs are needed everywhere. It's just up to the individual. Do you want to practice medicine? Or, hey, I'm just tired. I'm burnt out. I want to have a family. I want to see my wife, my husband, my kids. And unfortunately, in the system, even though it's a beautiful system, you work in many hours, and it's not for everyone. It isn't. I've seen the numbers, so that's why you have to have an option to go elsewhere.
Right. So tell me about this decision, because the decision that you took, like, as you said, while you're doing your rotations, you realized that this was, you wanted to stay involved in teaching, and eventually you kind of came back. That takes courage. And how do you, because, as you pointed out, it's a big investment. It's an investment of time. It's an investment of money, primarily. These are the two biggest factors. And it's almost like, oh, hey, I've already invested so much of time and money. I don't care about my mental health. I don't care about what I want. It's just I'm already down this path and I'm going to keep barreling down it, which, I mean, there are a lot of mental health issues that physicians are facing, and that's been exacerbated over the last 3-4 years during the pandemic. How did you manage that decision? Like, what kind of a support system did you have? Did you go through a lot of counseling? Did you talk to a lot of friends? What were the steps that you take to really realize that decision? Because I talk to a lot of students who are brilliant students, but they're kind of at that cusp that you're talking about is, I don't know that I want to do this for about 3-4 more years. I'm kind of done, but I also want to have a meaningful life, and I want to be, but at the same time, I don't know what to do. How do you make that decision? And their biggest thing is, I've already invested. I'm almost there. There's light at the end of the tunnel, but that's a light I don't want to walk towards.
Well, to add to that, that's why when you are preparing for step 1, step 2, maybe pursuing medicine, instead of focusing on something that you have a passion for that maybe you just heard about, you need to take this rotation seriously to say, well, I want to be OBGYN. I want to do, let's say, peds or surgery. I will invest my time now in medical school to see, hey, is it for me? Because you might love the idea of being an OB, gyne physician, but maybe when you find out the hours are that long, you don't want to do that. So that's why a lot of students, they have that love, they get in and they drop off, right?
Okay.
For me, I realized, and this goes back and it goes into my roots, and this is why I do what I do today. It stems from passion for medicine. I was a pioneer in my family. Parents, Greek, love them. They did everything for us, for me and my sister. Not in medicine, so I was the first person to pursue. I realized in the hospitals, through St. James, in the amazing rotations, working 60, 70-hour weeks, I realized some specialties were for me and some were not. And if I had as the school did everything for me, but the physicians I worked with, they did everything for me too. But I realized later that if I maybe had a different experience in, let's say, ER versus surgery, I would have gone down that path. Instead, I said, I don't want to be stuck in the hospital 80-hour weeks, writing notes, seeing patients, being exhausted, maybe not possibly having a marriage, maybe losing my wife. A lot of family people that I know got divorces. I saw the statistics ahead of me. And I'm like, well, I love medicine. But I also started doing the coaching, mentoring on the side, and that started blowing up. So I said, well, I can continue medicine, or I can pursue my actual passion, which is still in medicine, but then making sure doctors get into the profession itself, right?
Right,
so
right.
It's not easy,
Right.
my friend. It's a lot. It's not easy. It's a little luck to see what you're good into and risk. So that's what I took.
So, this is a big debate that is always in our offices. In my opinion, I should preface this by saying that there's truly 4 real professions in this world. No disrespect to other folks, but there are 4 real professions in this world. Okay. One is farmer, one is teacher, one is engineer, and one is doctor. Everything else is fluff. Mind you, I'm a trained CPA. So my point is that with these 4 professions, you can build civilizations.
Sure.
And you don't need anything else. And everything else kind of follows. Keeping that in mind, I also think entrepreneurs have a very important role, but that is once things are like, in an economy like the USA, entrepreneurship is very well respected. But you've been both. You've been a physician and you've been an entrepreneur. In your mind, obviously, there's definitely some synergy that you're a physician who's an entrepreneur. But in your mind, which one has more of a, let's call it flex, if you will? Being an entrepreneur, being a physician.
Well, I mean, for me, I've been blessed with doing both. But again, the reason why I say this is because I work with so many doctors and students now that are in residency, and they hit certain specialties, and then they're stuck because they go, well, I invested my time in pediatrics. I don't want to be a pediatrician. What do you do now? That's challenging, right? So I come up with a family of all business, family, father, mother, all the Greek families that I know, my cousins, and no one was a doctor, all in business. I was fortunate to also have that in my roots. Exposure. Yes. Now, that being said, a lot of times doctors want to be businessmen. They can't. The businessmen can't be doctors. They have to learn it, right? You have to practice it. But the way I look at it is I personally have much more freedom, much more, because again, I love what I do. I can work from anywhere. I had a morning webinar before we got onto this podcast, 150 doctors and students, step 1 prep. Those individuals, my passion is to help them pass step 1 to hopefully get to where they need to be a better healthcare system in the States, right? So for me, I love business, but I was able to merge both business and medicine than just being business somewhere and not enjoying the medical aspect of, because I love medicine, guys. I love it. I just don't want to be in the hospital working 80-hour weeks anymore.
Of course. I mean, that makes complete sense. Well, that's very interesting. They say that. So the main flex is that you are a physician entrepreneur, as opposed to, it's not one or the other. It's both. That's pretty cool.
I can't jump and go do something like I might have real estate, family. We have real estate, other things. It's great. A lot of money. There's no passion there. My passion is medicine. I don't want to be in the hospital, So I was lucky to find this.
So tell us a little bit about your companies. You said you had 5. Can you tell us why you had 5 and what's your latest company do? And can you give us a little background as to how many students you've helped and how long you've been doing this?
So to go back, because I'm early 40s, let's say, right? 45 years old. I've gone through a lot, especially through STEP prep. And this goes into explaining a little later the timeline of STEP. For anyone to grow and be successful, you have to adjust and adapt to the times. Those who don't, you can tell. If someone provides you advice that isn't updated, it won't work, right? So the companies that I created, they're all based upon step 1, step 2. And as we keep learning and having more success, we can then keep adjusting to different prep. Nowadays, live in-person classes aren't as popular as they were 10 years ago. 10 years ago, I had a live course in Chicago, 50 students every month. Nowadays, it's all remote, you see? So you have to keep adjusting and adapting to the lifestyle of USMLE. We used to have step 1, step 2, and step 3. Like you mentioned, step 2, CSCK. I had a course specifically for CS. We were working side by side with St. James to implement that in our studies. And then the pandemic came. So nowadays, my newest company is USMLE Trainings, where we take the technology of Zoom, right? The connecting with everyone in the world. We have live webinars, and make sure that your content is ready for step one, but also be a better test taker. Because I've realized through working with tens of thousands of students that you can learn all you want, but if you don't work to improve your test taking skills, you can study for years and then you don't pass it.
Yeah, talk to us a little bit about that, because I have actually noticed students who are very, very good academically, and they're actually doing really well in quizzes, in class. Teachers are like, wow, this guy's a great, student. They're definitely going to ace it. But when it comes to the NBME, they're not doing well. And then you talk to them, and then you're realizing that they have like this crazy anxiety. They're having the strategies that they're employing. Again, I'm not an educator, but it just doesn't sound optimal. So talk to me about this test-taking strategy. Are you born with it, or is this something you can develop? Or if you don't have it, you're never becoming a doctor?
It's a skill like anything else, whether you want to play a sport, right? This is a sport of sorts. It's a skill that, and I know because I was in school, St. James, a lot of universities, everyone does their very best. But we don't really focus on working on test-taking skills. So, read the material, read the PowerPoints, learn the content, yes. But then you have a USMLE exam, which is very different than anything else you've ever done before. So that's why I realized that if you don't adjust and expose students like St. James and everybody else watching to the question format, Doc, my friend, Doc, whoever's watching, reading the material, you have to apply to the questions. Like being in the hospital, right? You're in class and you go see patients. In class, I give you PowerPoint presentation, findings, right? There's no connection. So when you read a question, you have to be able to pull out the findings and connect. So to answer your question, it needs a lot of time and practice. And that's why one of the main reasons that we do at USMLE trainings is, hey, you got to come to us with knowledge. You're in medical school, right? So, okay, you know the basics. The problem is, can you put it together in a question, reading, understanding, and connecting? And I see a lot of students, American students, international, Caribbean, the biggest common denominator is test taking. They'll study for a year, man. They'll memorize first aid. They fail. Why? Test taking. It's a common denominator all across the board.
Okay. And as far as these test taking skills are concerned, and do you kind of help them like through drills, or is it like counseling sessions? What does that entail?
So we meet doctors twice a day. Morning and afternoon, which is nice because not only do now we work on accountability, which is another issue that students have. They can't, they need a study partner, they need somebody by their side, they need to be consistent and disciplined. So we meet them twice a day, an hour each time, live, and people from all over the world jump on, students and physicians, and we choose certain systems to attack for the day. So I have selected these questions. I go through one by one. I highlight and show them what to do to attack the questions, to save time, to be more efficient and effective, and also to learn the material. Like if it's something of concern that I see students having issues with, I always bring it up in our lecture. So they're accountable, they're disciplined, consistent, and I'm telling you, with a little practice, anybody can take the test, but you have to practice test-taking skills. Okay.
How much time would you recommend students dedicate for, say, the step one? Let's just talk about step one.
Good question.
Is it like, because I recommend that students should be studying for about 8 hours, at least 3 months before the test. Is that too much, too little? What do you think?
To answer the question, because those who know me, I can talk all day. A typical student who has dedicated prep, right? For example, St. James, if you give them 3 months of dedicated prep, meaning nothing else but studying, yes, 7 to 9 hours, 8 hours a day, 3 months should be more than enough time to go through the content, answer questions, and move. But there's many variables, right? There's many variables involved. So the variables are you a good student? Did you do well in your basic sciences? Are you able to sit in an environment that you choose to study all day, or are you on YouTube, Netflix, you go hang out, listen, we've all done that, right?
TikTok now.
TikTok, Instagram, and then next thing you know, you're studying 10 hours, but you've only had 2 hours effective prep. So what I realized is to answer the question, anybody who has passed every semester in med school, decently, obviously, B's, hopefully B's and A's, and you have a good 3 months solid with adjusting and checking out where your weaknesses are and assessing, there is no reason why you can't. But then there's people who have issues with memory, recall, they don't know the content, they can't stay disciplined. Then obviously, if you can only give 4 hours a day, you still can't do it in 3 months. It's going to be a lot longer, right? It's a sliding scale. So for the average, 3 months, 8 hours a day, it is a decent approach. It's just now you have to think about the variables for every student, and then go from there. That's all it is. That's the honest.
Okay. So now let's talk about the test a little bit. Obviously, you've taken the test a couple of years ago yourself, and then now after that, you've kind of built 5 businesses around essentially testing and testing patterns. So if anything, I don't think that there is anybody who is as well versed with the USMLE step 1, 2, and 3 better than you, because at some point in time you took these 3 exams, you passed them for your own career advancement, and then you started businesses to help students. What if you can give us like a general timeline from the time that you took the test, step 1 and step 2, let's focus on those 2 because our students need to finish those 2 before they graduate.
Of course.
And how has it changed since the time you took the test for the first time to today when you're teaching students? We had the pandemic. We saw like monumental changes in the exam. Yes. Even USMLE has come out and said that they haven't made changes like this in decades that they've done in the last couple of years. So why don't you talk to us a little bit about that?
Sure. So, I mean, ideally, before we begin, a lot of students have asked me, hey, you haven't taken the test in 10 plus years. How do you know? Well, when we prep our students, right, we see their success, we see what works, what doesn't, we adjust, we adapt, and then eventually we come up with a formula that works for everybody, right? So that's why even though I haven't taken the test recently, I feel that every student that works with us, I've taken the test because I see what works and what doesn't.
Absolutely.
Way back when I took it, it was a lot easier because the structure was different. It was more buzzwords. It was more, if you can understand some phrases, you can recall the information. Resources were not as a large amount of resources as we have today. The technology was different, right? So we had few resources versus now people have they're saturated with resources. But the exam itself has come to a point where it's getting tougher because it's the way they ask the questions. They take a simple disease that you know about and they just create such a way that's third order. It's not just first order. They actually have different steps that you must know to get the right answer. So that's why step 1 is challenging. They've changed it from scores because we had scores back then, and little by little they keep adding, they keep increasing the minimal. You good?
Yeah.
They keep increasing the passing score to eventually fast forward to when they say, hey, ladies and gentlemen, we're going to go pass or fail, right? So that's step 1. It used to be a score. They used to increase the number eventually. Now they went from 50 questions down to 40. It's more challenging. Why? Because you have to get more questions right. So step 1 is more difficult in many ways, specifically for that. It's not recall as far as buzzwords. It's more of just being able to connect the dots for step 1.
So you're saying that step 1 exam has become conceptual, a lot more conceptual than it was before. And this change is relatively recent, or has it been on for like, say, half a decade, 10 years already? Or is it just evolving every year?
It evolves because, again, these questions are written by MDs and PhDs all over the world, right? They've been created for the purpose of USMLE. So I would say in the last maybe 6 to 7 years, they started bumping up the cutoff point to eventually changing the style, the format of questions, to then allowing Q banks like UWorld, Amboss to adjust, because that's what we use Q banks.
Right.
Test and fail, take it again. Ideally, we want to use a Q bank. So step 1 got to a point where when they decided to go pass or fail, they did it to alleviate stress, because a lot of us out there without a high score on step one, your future is over in certain specialties. That's how I grew up in medicine.
Right,
if you don't score high in step, you will never be a surgeon. Excuse me?
Right.
No, you have a passion, but Stavros, you will never be.
Right.
They chose to make it into pass or fail. Do you know, because of that, all the numbers dropped. You can go on USMLE.org. You can see the numbers have dropped. MDs, American.
By numbers dropped, you mean less people are passing the test?
Correct.
Okay, and this is systemic across the United States. Even U.S. schools are facing the same thing?
Correct. So because they have it on USMLE.org, it's American medical students, international, which are foreign, Caribbean, and international. All their passing rates, the passing scores, have all dropped, including DO schools too. So, and that's accessible. You know, we could put the link at one point. It's there.
Right, sure. We'll do that. So by how much do you think it's actually dropped? Or how much, at least from your experience dealing with all these schools and all these students and teachers, what do you think that percentage is? Like ballpark? It doesn't have to be accurate, but from your experience.
I mean, when a test has a 98% chance in the American students, and it goes down to like 94, when the Caribbeans are 94, now it goes to 91, you might think 3, 4, 5% isn't that much. But when you see a consistent drop in passing scores all across the board, and then when I myself talk to medical schools and students, and they say, Dr. Stavros, most of my class can't pass a comp exam. Most of my class can't pass an NBME, which is what we do and sponsor to pass a step. Well, it's a nice safety net, but there's a problem, isn't it? Well, it's either the test is getting more difficult, which it is, but we, the community, medical school, students, programs, have to work harder to say, okay, because everyone's dropping, there's a reason. We have to figure out what to do. And a lot of people don't put the time into prepping step one, because they figure, hey, it's pass or fail. But yeah, the problem is if you do fail, my era back then, if you failed, you come back with a score and you can prove to whoever's looking at your application that this student failed, but now they came with a high, maybe 40 points higher than average. Versus now, if you fail once with a pass, you come back with a pass, you can't show to the person looking at your application that you scored a 260. You see, that's why it's important to pass on first attempt. But
so that's funny that you say that students are kind of not like, just because it's pass or fail, the amount of effort that they're putting in seems to have gone down.
Yes, I can say yes.
And we see that with students. It seems like a normal trend amongst at least our students is that after they do well on the NBMEs, they go on vacation.
And then they go. Let's all go together.
So I'm actually being very serious about this. And I don't know if you're seeing this amongst your students. I mean, because I'm localized to St. James students. And it seems to be a trend that a lot of students are like, hey, I did pretty well in the comp. I need a breather. I'm going to go on vacation. And they go on vacation. I would personally and of course I'm right around your age. In my time, you don't go on vacation until your end goal is met, which is step one.
Sure.
You don't go on vacation for the NBMEs. And this is something that honestly only happened after the scoring went away. We never saw this before. Yeah. And I'm beginning to think that this is the mentality. Like, it's hey, I did really well. I mean, and the NBME gives you some sort of a passing percentage. If you take the step within X number of days, this is your probability. If they see a high probability, they're like, I'm going to pass anyway. So I'm going to go on vacation. And they go on vacation and they come back and they've kind of forgotten everything. They're out of the groove.
Sure. And
they're not doing well. What's your take on that?
So before we continue, I think we look pretty good for our age. We're aging very well, so that's a good thing. Props to us. To go back to that, I have to add some to that, to what you just mentioned. Our generation, yes, we hustle, we grind, we go. The difference is, I feel that the discipline, we work hard. Nowadays, I feel those who want to take a break, it's either they feel like, it's a pass or fail, but also sometimes because they're so stressed, they're so exhausted, and they're so burnt out because maybe, the studying, the habits, the balancing, time management, that they need to take a break. So in some instances, people need to kind of get away, but when they come back, like you said, they're not in the zone. I feel the pressure is gone. And because of that, they don't push. Like CS, which we'll discuss a little later.
Okay.
There's no CS. Okay, so why buy a book for the CS exam, clinical skills?
Okay.
Here's the issue, guys. Step 1 is a foundation for step 2. I have a student that just scored very high in step 2, 262. He worked really hard, Caribbean student, for step 1, worked really hard, like you guys out there, right? During rotations, NBMEs, and the rotations and shelf exams, he pushed hard. He took 4.5 weeks to take step 2. You know why? Because he did all the work from step 1, all through rotations. Trust me, he didn't want to study on the weekends. He didn't want to study at night. His family was at the beach. But he goes to me, you know what I did? I did what you told me to do. And when I had ready for step 2, he now has the door open, emergency, surgery, anesthesia. Why?
Wow.
Because he invested and he gave up a little earlier to now he's like, yo, the whole year I'm going to relax. Respect. Because I could apply for the match with a high score.
Yeah.
That's easy. So those of us that I work with and those of us listening now talking, if you think pass or fail is nothing, you might just pass, barely pass. But then it's going to catch you later for step 2. I'm telling you it will. So if you take anything out of this podcast is if you really want it that bad, you work hard. And if not, we discussed other options in medicine. But the pass or fail has alleviated the pressure from us, which that was the goal to do. But everyone's like, oh, I don't have to study that much. I just got to pass the thing. Okay, good. Okay. You get caught later. I've never seen it otherwise. It always happens.
So I want to talk about this a little bit more in the sense that so for example, most Caribbean schools follow so there are 2 ways to do a curriculum, right? A subject-based or a system-based.
Yep.
And most Caribbean schools tend to follow a subject-based approach, including St. James. But St. James is a little different because we have a hybrid where we do a review in a system format.
Correct.
In your experience, and I would say 80 to 90% of Caribbean medical schools follow a subject-based, or they're following something like us, which is kind of a hybrid mixture of both.
Yeah.
And the reason we do this hybrid is because we feel like once you teach everything on a subject base, the system kind of brings it all back.
That's it.
But in your mind, is there a particularly more advantageous approach versus between subject and system?
Everyone learns differently. So what I realized is from the majority of students I've worked with and myself when I went through curriculums, especially St. James, subject is the best because when you're starting medical school from the first time, because this is clearly you started medical school for a reason, you get really confused when you take a system like cardio and you hit everything within cardio because it's broken down that way versus you go little by little, you learn anatomy first, histology, embryology. You can appreciate the biochemistry of things. You can appreciate microbiology, the bacteria, the viruses, and all the bugs and drugs. And then when you get to systems, we're doing cardio? Yeah, you learn the cardio, but then when you go over micro, you say, but I've been exposed to micro. I've been exposed to the bugs. So now I can appreciate the differential of a cardiological disease.
Okay.
I say, interesting. The person has, or like respiratory, person has pneumonia. But then now I can understand why the pneumonia he has is actually tuberculosis because I did it before, which then I know why it's TB, what drug we provide, what's the mechanism of action, and so on. So I've realized for the majority, system is not for everyone. It's usually subject first and then hit the systems hard to bring it all together. Others do it the other way, but it's more challenging that way. I feel it's more challenging.
Okay. Well, that's good to know. So the other question I did have for you, and this is kind of a big debate, especially among medical students. Because medical students don't want to take the NBME because they think, I don't want to take the NBME. Without passing step 1, I want to be able to do clinicals.
Sure.
St. James, we don't allow that. You have to pass the NBME. If you get a passing score on the NBME, that is the only time you are allowed to take step 1. If you clear step 1, that is when you're allowed to go into clinicals.
Yes.
Most of our clinical partners, like the hospitals, they're all teaching hospitals. They mandate that the students have step one. It's not like if we wanted to, we could even send students without step one.
Correct.
However, there are I think you know this, Dr. Stavros, there are over 75 Caribbean medical schools. Only about 20 are accredited. So the ones that aren't accredited tend to just push students into clinicals.
Let them slide in.
And then a lot of students are like, and we've had students transfer out, good students come and say, hey, you know what? I don't want to go through the grind of step one. I want to start clinicals right away. So I'm going to go to an unaccredited school because, they're promising the sun and the moon and everything in between. And because of that, I'm going to ace it. I'm going to get into clinicals without step one. I'm going to finish clinicals. And then I'm going to take step one and step two together. Sure. What's your thought on that?
So I want to mention something. This is from my experience, and this is because I can say what I want to say. Usually, it parallels, if not, really, it's the same as what I see with student success. The best way to approach this is to struggle and push now to pass step, because if you don't take the NBME, clearly you don't know if you're going to pass or fail. Fine. Those schools that don't really require NBMEs, you fail once or twice. I hope everyone understands that even if you fail once or twice, some states in the country will never give you a license.
Oh, wow.
Some states in the country have requirements to say, okay, you come to my state, we want first attempts only. Okay. There are other states that have limits of four attempts and 6, and there's a website I'll provide to you guys. You can put it on. So that's that. So you can get licensed elsewhere, but some states will never give you a license if you failed one of the exams. That's that. Let's go to jumping over. Okay. We decide to tell students, you know what? You don't need to take the NBME. Forget about the step. Start rotations. They go through rotations. They learn now step 2, clinical knowledge. They finish everything. Your school's happy, meaning whoever school's doing this. And now the students are stuck. I'll say the word stuck for a reason, to go back and learn step 1 and step 2. Okay. I have met very few students, that were able to attack 1 and 2 together in this form, in this new way of directing students, because they lose hope eventually. They go, I finished my rotations, I paid for my tuition, my everything's good. Now who's going to help me? I got to go back and learn everything again after a year and a half of rotations, right? It's 2 years.
2 years,
year, and then a year of electives. So it's 2 years of learning clinical knowledge. And some will say, well, I can take clinical knowledge first, step 2, and then step 1. Okay. The chances of passing step 2 are higher because you've just finished rotations. But that's step 1, guys. Without that step 1, you're not going anywhere. And I would say 90% of people that I know that have attempted this style, this routine, have never finished step 1. They've done step 2. Okay. Their step 1 has been their nightmare. And because of that, they eventually jump out and they do something else in medicine.
Right. And I think because of that, relatively recently, the NBME actually doesn't allow that anymore. They don't allow you to take. You have to go sequentially. You have to have a passing score in step 1. But I think that's recent. And when you're telling me this, it kind of makes sense that they introduced this, because a lot of students must have done that. They probably took step 2 and got stuck in step 1. They don't have step 1. They just have step 2. So you think it's not a good idea to do that, right? Like.
Well, we'll probably get emails. Guys, I get that. But you have to understand one thing. The reason why we take, first of all, NBMEs, I don't like. I'll be on record. I like them for what we use them for. I just feel all the schools, including St. James, we need to do something better about helping students adapt from Q banks to NBME. Even when I do them, like, wow, these are not easy. Like, this is like when you're doing a Q bank, reading questions, they spoon feed you everything. Okay. NBMEs are meant to do 2 things. They give you a 200-question exam. The first 100 questions, you don't have a break. The questions are very short, 2 lines, bare minimum. They go, what? But the Q banks are 3 paragraphs and they're 40 questions. They figure if you're able to answer a 200-question exam and give you the bare minimum, and you can still get it right, that means you know the concepts, you know the foundation of medicine, which that means You walk into the actual exam where they have 40 questions instead of 50, and they have 3 paragraphs instead of 2 lines. You're going to pass, right? That's the whole concept behind NBMEs. So, yeah, those who are failing in BMEs, it's usually concept, but it's also they're not exposed to the way the questions are written.
Right. So what I'm hearing is that it sounds like the step 1 exam has become a very conceptual exam. So essentially, if you go and memorize entire UWorld and AMBOSS and first aid, yada, 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 you're probably not going to pass because you didn't understand anything, right?
Well, back then when I was taking it, we had something called buzzwords. We had certain resources that we memorized because it was like that.
Okay.
Now you can memorize anything you want. If you're a photographic memory, fine, you'd be passing everything. It's very hard to memorize everything because even then they need you to connect. If you don't connect, you can't pass. That's all it is.
Gotcha.
They've adjusted it.
And now talk to me about step 2. Step 2 also has had a lot of dramatic changes. So why don't you walk us through what the changes have been in the last decade?
So step 2 had two brackets, clinical skills, clinical knowledge. Clinical knowledge was the basic exam that teach to see what you know in your rotation. So you go through all the cores, surgery, gen surg, pediatrics, OB-GYN, family psych, peds, and then you take a test. That test is going to see what you know. Fair. That's also challenging in itself. The CS exam, clinical skills, was something that I mastered, that I loved, that I was teaching to doctors all over the world, because there were 5 locations in the country where you have to fly in if you were not in the States. Philadelphia was one of them. Chicago was another. 5, you come in, you see 12 patients. They were actors. They weren't real patients, but they would test your skills. They had a huge list of like a score report, like a checklist, empathy, sympathy, medical knowledge. I mean, everything. And people would fail maybe their English part or their bedside manner part.
Right.
So that was very challenging, but it actually was one of the best exams because it brought to attention that you need to not only know medicine, but you need to know how to handle the patients, right? Okay.
Right.
So the pandemic came, it was on hold. They froze it, like everything froze for a while. And they thought about possibly going to an online version. And eventually, fast forward, they released a statement that they were. Fast forward, they released a statement on one morning and it said, ladies and gentlemen, we've decided to pull the license exam completely off our list. So you don't have to take it anymore. Okay.
Right.
So that was out. One less exam for everybody. Problem was, though, that people were going through rotations, not really checking their clinical skills. And then now to this day, I'm in relationships with many different residency programs, family program directors, and they've told me, they go, our candidates are not as strong as they were in their clinical skills. And that's a combination of the exam and virtual rotations. I mean, I know we maybe have done them, a lot of us. We had to move on. Most of the students that I know have. But you can't learn through the computer. You have to be touching the patient. You got to be hands-on, right? So the clinical skills was something that was a huge blow in the community. It was good for students, but now we see we see the blow. Students are not working on clinical skills. They don't really know what to do and how to do it. So it's challenging.
Okay. And what about CK? CK was always the knowledge portion, but are you seeing, I mean, I believe even that test has changed. Are you seeing reduced pass rates in CK as well, like you're seeing in step 1? What's your experience with that?
So the CK exam now is the biggest exam to focus on, because once you pass step 1, again, step 1 is important because if you don't pass, you automatically can't license in some states, fair. And granted, when you pass with a P, you're still on the same level with everyone else. It's a P for pass. Now step 2 has its highlight. Now it's famous. Like, oh, well, now you have to score very high. So the pressure was taken off of step 1. Now it's on step 2. Before step 2 really wasn't that big. It was like, step 1 was a pressure. Right. So USMLE, I feel, changed it up and just put the pressure on step 2. So step 2 is more challenging. Step 2 is 8 blocks instead of 7. So you might think it's nothing, but if I asked you to run a marathon and when you finish, say, all right, run 5 more miles. I don't know. I don't run marathons. I run 5Ks. Same concept. You do 7. Now let's do 40 more, right?
Wow.
So, and step 2 is all about learning the stuff in the hospital. So at the end of the day, the pressure's gone from step 1, you still got to pass it. Now step 2, you got to score super high, or else you can't get into some specialties. It's actually more challenging because that's what they require. So they just shifted the pressure around. It is challenging because what if you don't have a strong rotation? What if you go and your preceptor isn't teaching you everything? It's up to you to go home and study, right? I didn't study. I would go home and relax personally. I'm like, I don't want to keep reading. I'm tired.
Okay.
It catches up to you. So it's a lot of pressure everywhere. And that's why now with step 2 doctors I work with, yes, failing. I don't think people fail step 2 as much because they're working hard on step 1.
Right.
Transition over. Those who don't do well are those who perhaps are not in medical school anymore. They're trying to come to the States and they're just on their own in their living room, back room. And it's hard, right? I mean, if you're by yourself, I mean, we have each other. We're on Zoom now talking, virtually. Right. Others are home all day studying. I don't know about you, but if you don't have a certain support system.
Cabin fever, yeah.
Oof, you're going to drop fast. And those are the ones that I usually see fail because they go, I can't do it. I don't know what to do anymore. There's no guidance, right? That's where I come in.
That's awesome. So, I mean, generally it sounds like, I mean, we've always been talking about how the US is really trying to increase the number of physicians.
Sure.
Because by merging of DO and MD, then introducing so many new DO schools.
Sure.
Et cetera, allowing, investing more in residencies for IM and FM, et cetera. But on the flip side, they might be increasing the opportunities, but they're also tightening the clamps, it looks like, from the step 1 and step 2 portion, because they're not they want better quality to fill those more positions that they're creating.
Yes, and for those out, we need to know this, that USMLE used to have 6 attempts, now it's 4. So
yes.
6. So people, unfortunately, I get it. You were tired, exhausted, issues happen, you took the test, somebody passed away in your family. I understand, right? But at the end of the day, if you fail 4 times, you're out of the system completely. They figure if you can't pass the first 3 or the first 4, the chance of getting into any residency are slim to none unless you know somebody very well. Even then, it's not going to be successful. So that's the risk. Yeah, the tightening the clamp. Yeah, it's medicine, guys. You're applying for a job, right? In a top university or hospital program that you are one day helping people with their health. Right?
Yeah,
they look up to
their
you.
Lives.
Their lives, sure, lives, of course. So it is challenging. It's doable. You have to navigate well. Or else it's very hard to get in. That's
right. I always tell people that actually both entrepreneurship as well as medicine, these are not professions. These are lifestyle choices.
Oh, lifestyle. 1,000%.
Okay. Yeah. And because it seems like it's like the amount of work that goes in, the amount of time that goes in to both of these professions, depending on what kind of an entrepreneur you are. But this is not 9 to 5. If you are looking for a 9 to 5 and work-life balance, what would you say? Like this particular, I think a big buzzword nowadays, especially in the workforce across the board, is work-life balance. What would you say to somebody who would comment or make those comments, especially in and at the same breath they're saying, I want to be a physician?
So those who know me will know me well, and I always, we always speak the truth, right? Tough love. If you're in medical school and you realize maybe you're failing or you're struggling semester after semester, okay. You figure out why, right? Eventually, it has to be the individual. Schools can do what they can. They can't spoon feed. They teach you the best they can. But I realize sometimes students go to school because of family, because there's some pressure, which I know they want the best for us, our parents. But hey, maybe it's not for me. Maybe I don't want it. Then you slide somehow, finish in med school.
Right.
You get into residency, or you hope to get in. You realize there's no passion. You eventually will burn out, get exhausted, get frustrated, not live your life, not love your life. So I would say if you're watching this now and you are in medical school and you realize, man, it's not for me, I don't want to say jump out, but maybe another option would be beneficial for you because time is valuable, right? It's your life, it's your future. And then if you are in rotations, this is what I didn't do, which I want you guys all to do now. When I knew I didn't want to be a pediatrician, I did my peds rotation. I'm like, all right, I'm just going to go and get out. But what if I put my heart and soul into it to expose myself to all of it? Maybe I would have been like, hey, wow, this is actually pretty cool. Versus, I know I don't want to, right? So this is different stages because the biggest thing I've seen are doctors choosing a specialty. Well, I have a couple guys that did internal medicine peds. They got into residency. Second year, they want to get out. I'm like, but what happened? You knew it's no surprise. They didn't love. They just didn't see the sums do. They see themselves doing it. Have one anesthesiologist. He finished anesthesiology in Northwestern. Love the guy. He goes, I don't want to practice. I'm like, why not? I'm tired. I'm tired. Top university in the States. Great guy, friend of mine. Top residency, Northwestern in Chicago. Are you kidding me? Untouchable. He goes, I'm good. I don't want to do it. So something clicked. He goes, I don't see myself living my life, even if I'm making the money, to be doing this. So I ask of you from now, talk to your doctors, talk to your preceptors, now dig and say, hey, what's a daily life in a pediatrician? Right. Cardiothoracic surgeon. Do you know what that takes? Yeah. You should, or else it's a life. Like you said, life choice, not a job. Yeah. You gotta love it, guys, or you're not gonna make it. You're not.
So just out of curiosity, what is this particular gentleman doing who was the anesthesiologist from Northwestern?
Good. He was one of my coaches at a previous company for a while, and then now he went to the East Coast to pursue a specialty more in admin. So he has anesthesiology. He's board certified, but he's using his knowledge, his education, his experience in more academia and university. Universities need MDs too, guys. So things have changed. Things are like, when I see an influx of people coming to me, they want a job and they're leaving $400 to get a lower salary to coach students. Yeah. There's a reason why. So it could be anything from burning out. The program was too intense, time management. They were in love with it, but now they don't like it. We're human, right? We're not robots. So things change. Be honest.
That's a very good point. We actually do a lot of work with Northwestern, and pretty much in their medical school, most of the folks are actually like physicians. Like they have an MD, they're board certified, but they're doing admin work. So it's a very good point that you bring up. So that truly is another avenue for physicians to get into academia. And like their head of research, for example, if I'm not mistaken, she's obviously an MD, but she's not an active practicing MD from my understanding. But she's board certified and obviously has a license and everything. But she's teaching. So.
And everyone that I meet, I travel a lot, and they go to me, wow, I'm really, you have a wonderful passion. I'm like, I'm just lucky because I love what I do. Mm-hmm. A lot of them like, well, the grass isn't greener. You gotta water where the grass is and build it yourself. Right. But a lot of people are like, I want to do more. I have doctors who are OBGYN, and they started doing Botox injections. So instead of having all that malpractice, I can get certified. I can go to women's homes. I can have my own little spa, and I can start doing injections, make more money. Because at that point, they go to me, Dr. Stavros. Stavros, we're friends. They go, I don't see my kids. They go, I make a lot of money. I just don't see my family. So I've changed. Now I will do different things to enjoy my kids and make more. Yeah, that's how things are evolving now. That's it's happening.
And that's very interesting because this is a little philosophical, and we're going on a philosophical tangent here. But once I read, I can't remember. I think this was Elon Musk or a really famous person who said the difference between having a lot of money and being rich is having control of your time. If you don't have control of your time, you're never rich.
Yes.
If you're working, 140 hours a week,
not working,
and you're making a ton of money, you're not rich because you're not really you don't have the time to enjoy that money.
Yeah.
So,
right. 100%.
So it's a very good point that you bring up. It's they're working a lot, and they have a lot of money, but at the same time, what's the point?
Now going back to money, because money does make the world go around. Of course, some people choose medicine for the money.
Yes.
They realize residency, it's very little. You'd be lucky to make $65,000 a year.
Yeah.
3 years of residency. And a lot of people who aren't in medicine don't know that. They go, you're a doctor. Oh, easy. Residency, you get very little.
Yes.
That's before taxes. And then hopefully you get into a good specialty. Hopefully you're going to pursue a certain university. It's usually a business. They have certain budgets, right? Certain amount of money to provide. So then those who go in for the money, sadly to say, many of them jump out. They go, man, I can't do it. Like, well, yeah, because you're going in for the money and you realize you're going to make not the money that you wanted to make. So that's another. It's like it's not a solid passion to have, because you run out so fast when you're not getting the money that you really want to have.
Yeah. The other point I wanted to make with that residency portion is that you're working up to 80 hours. It's not
minimum,
up to
60 minimum.
Yeah, you're working 80 hours a week. And when you equate that 65,000 to 80, it's below minimum wage. That's what you're getting.
And, I have friends, all of us have survived on that, whether we have investments, family support, loved ones are cooking for us every day. You make it work. But think of it this way. After taxes, you're not making that much and you have to pay rent. Again, if you have a passion, though, you make it happy. Like, I don't care. I'll eat mac and cheese every day. I don't care. But those who are like, well, you know what? It's not for me. Well, then you don't have that enough passion to go. Because if you have a passion, like building a business, starting from scratch, taking what I knew from one to build the next one, the stronger one, there's always risk, right? But I have passion in what I do. I'm confident in what I do, and I make it work. Yeah. You need confidence. You need to have that passion, or else it will not work for you. That's what usually happens. Yeah.
That's tough. That's crazy. So, I mean, if you equate like an 80-hour work week at 65,000, that roughly equates to about less than $15 an hour.
Yeah.
So,
And what happens is, and this is, again, I love examples. I was working at Cook County, Rush University too. And then I was working at the University of Illinois surgical team, general surgery. And I was with the chief, 5-year, great guy, friends to this day. He was married to a family internal medicine. His wife was internal medicine at Cook County. He was University of Illinois chief surgeon, Caribbean student.
Right.
He goes to me, this is when I was a student. He goes, Stavros, I got to tell you, man, I love my wife, but she always gets mad at me because I don't get home in time. She's in medicine. She's actually chief of internal at that time.
Right.
He's chief of surgery. He goes, honey, I can't come home till I finish my surgery. Right. By the way, someone just came in 10 minutes ago and I got to have a 4-hour procedure. Even then, didn't understand. So you see, it's tough. Like it's no matter what, passion, sacrifice, being the right person, you have to set it up the right way. It's not a sprint, it's a race. And if you don't have a support system by your side, it's challenging, guys. It really is. A lot of obstacles to overcome every day.
So, Dr. Stavros, as far as your agency is concerned, your institution is concerned, helping students, if any of our students are stuck, what would you recommend they do? How would they reach out to you? Is there a circumstance when you look at a student and you're like, this guy's beyond help, I can't help him?
Well, I'm sorry, go ahead. Sorry.
No, so that's why. Have you had such? Are you like rejecting students? Are you willing to help anybody? What's the like? How do you? What should a student do? When should they reach out to you?
So a couple of things. I'm always a believer of providing the best advice I possibly can. And sometimes we're not meant to work with some people because they need more prep. They need more time to build the foundation because maybe they're out of school, right? But as long as I can provide some advice for them to get on the right track, maybe they come back to me a year from now, 2 years from now, maybe never. But at least they have the right information instead of going online, searching different forums, which I like. But you got to be careful who's out there because how can you credit? There's no credibility. You don't know who's saying what, where, how. So usually medical students, first semester, second semester, third, fourth, fifth, preparing for step little by little is the majority of doctors we work with. We work with doctors, in the Caribbean, international. As long as you're in school, outside of school, and you want to dedicate and sacrifice, we work with everybody. Very few do we say, hey, I can't work with you, unless literally they can't dedicate an hour a day, which is very rare, right? Okay. So if they visit USMLE-trainings.com/step1, they can go to the website. They'll see my webinar, learn everything. Reach out to us if you need to. We'll talk to me or my staff. And if we feel that you need prep now versus, hey, you need to come back to us a few months from now, this is why we do what we do best and why all of our students pass. It's just give them the right guidance, the right support. Okay. Make sure they do well. So typically, that's the whole point. You got to sacrifice, right? And navigate. We'll do it for you, with you.
Right. And you mentioned that all of your students pass. Is there like an official statistic on that, or?
You know why they all pass? Because, and we all say, oh, guarantee. The reason why they all pass is if they, and again, I'm honest, there's some students I do not allow them to take the test because they can come on and work with us for 2 months, but then they're not strong enough. I'm like, well, I did everything I could. There's no way I can sponsor you. I can actually, advise for you to take your step 1 because you're still lacking in X, Y, and Z. So then, we provide a little more support. They keep working on their weaknesses, and then they go past the test because this is their future, right? I mean, I can't allow somebody under my support, under our team, to take the test and fail, because when they do, they can't license in some states. Their journey becomes much more difficult, and many of them are like, man, what am I supposed? I gave up my family and I failed. So I take it personal. That's why those who work with us, you're not going in unless, like you said, NBMEs and assessments. So I can honestly say no one has failed under the guidance that I provided, following the right resources and the assessments that I need to have before you pass the test. It might take 6 months, might take a year, might take 2 weeks. The fastest I've done was 4 weeks with a few students. But again, they need to help people hear this. They go, oh, I got to do it. No. You need to have the foundation, right? You need to know the medicine. And I can show you the test taking skills to actually make you a rock star, pass the test.
And what's the best period for them to reach out to you? Is it MD4? Is it MD5? Is it after they've failed the NBME a bunch of times? When is the best time for them to reach?
You can reach out to me after. I would say this. There's two parts to this answer. A, for those who are in MD3 and 4, preparing slowly, knowing that an MD5, St. James and other schools want you to take an NBME to get sponsored for the step, don't wait to the end. Come to us. We'll guide you to make sure you're on the right track. Fine. For those of you who just started medical school last week, last month, they're like, I don't want to listen to this guy. I'm not ready yet. Oh, no, I get it. But what we do is we also have a huge library of videos. So what I didn't have as a student is I had resources. Like now, you could buy videos. And you have the Q Bank, but no one does it together like this. So I have some students now, they go to me, Doc, I failed step 1. I failed my NBMEs. Watching your video, going through glycolysis cycle, using this question and teaching you the content behind it, I learned better that way than watching. Videos are great, but nothing is clicking for me anymore. So for those of you, like remember MD1, like for example, do you know what classes you teach on MD1 too? Was anatomy, histology? Yeah. So wouldn't it be nice for students to say, well, I can listen to my professors and my doctors in St. James, but I also have a list of videos from Dr. Stavros that I can parallel to expose to questions, no pressure. So then when you get to MD3, you're like, well, I've been watching these for 2 semesters, 3 semesters. I'm getting acclimated to the style of questions, which then increases the chance of passing NBME, being more disciplined because they're watching the videos. And then your numbers rise because they pass faster, they get into rotations faster, they get into step 2.
We definitely want that.
Domino effect, right? It's just they don't see it. We do. They don't see that though. That's the problem.
Right. And that's the thing. I mean, if somebody has a resource, they don't necessarily know what it's like to not have that resource. I mean, that's where, the whole concept of quote unquote privilege comes in. And if joining an additional program gives you that privilege, why would you not take it? Because
then you don't struggle for NBME. And again, if you realize medicine isn't for you, please, and I advise a lot of students, I'm like, truthfully, they might be married, have kids, maybe they're doing it to make money for their loved ones. Other times, man, it's not for you. That's cool. I mean, accept it. But if you're in it and you have love for it, well, let's get it done. Let's pass the test and move on. It's navigation, man. It's all guidance and navigation and support.
Thank you so much for these valuable insights. If anybody of you need to reach out to Dr. Stavros, his contact information will be in the comments below. And if you like the content that we're producing, give us a like, give us a follow. You can download our episodes on any one of your favorite podcast providers, such as Spotify and YouTube. And remember, there's no shortcut to becoming an MD.
Thank you so much for tuning into our show. We hope you enjoyed another episode of Med School Minutes. If you like our content, please follow us and receive notification when a new show is posted. This podcast is brought to you by St. James School of Medicine. For a video version of this podcast, please check us out on sjsm.org/video.